Hi, welcome to your cranial nerve exam. How are you doing? Do you have any weakness in your face? Do you have any numbness, tingles? Okay, so I'm gonna go ahead and put this on your face and you tell me when you feel it. Ready? Good. You felt that? Perfect. Right there? Okay, can you puff out your cheeks for me? Stick out your tongue. Raise your eyebrows. Don't let me push your shoulders down. Good. Okay, now I want you to breathe in for me and hold it. Breathe out. Good, now I'm going to do that again, but I'm going to actually listen to your heart, okay? So when I put these in, I just want you to stay relaxed, breathe like normal. Go ahead and breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Awesome. All right, so I'm going to check your vision and your hearing very quickly. Okay, so I want you to look at my nose and tell me when my fingers come into your vision. Okay, ready? Good, right there. Perfect. How about here? Good. Here, perfect there. Okay. Oh, both sides. Awesome. Okay, now for your hearing, I just want you to let me know what I'm saying. Repeat it back to me. 1, 2, 3. Good. 1, 2, 3. Perfect. 4, 5, 6. Perfect. 4, 5, 6. Awesome. Okay, now I'm going to test your taste here. I'm going to spray this on here and give this a taste. Tell me what it tastes like. Vanilla. Awesome. Okay, one more time. Chocolate. Very good. Okay, now I'm going to do your smell. I'm going to pop this little jar here to give it a little whiff. Tell me what that is. Butterscotch. Awesome. Okay, go ahead. Pop this jar. Tell me what that is. Lavender. Very good. One more time. I'm going to pop this jar. Tell me what that is. Mint. Awesome. Well, I think all of your nerves are working as intended. Hello, hello, hello. So you're the patient everyone was talking about. Okay, sit down. Let's see how bad it is. All right, I'm a neurologist, so I'm going to test what's going on up here in that brain of yours. Okay, very important things going on in there. So I'm going to do a couple tests, all right? So first, I want you to keep your jaw closed. I'm going to try to open it. Oh, you let me open it. All right, now that it's open, don't let me close it. Don't let me close it. And I closed it. That's fine. Can you stick out your tongue? Your tongue. Your tongue. Stick out your tongue. All right. Go ahead and look at my nose. Look at my nose and which finger's wiggling. Okay, let's try that again. Which finger's wiggling? Okay. We'll do a little memory test. How about that? Okay, I'm going to show you some cards and you tell me what order you see them in. Ready? What order did you see them in? That wasn't even one of the options. What is this? What is this? No. Okay, there's something going on up there. Can you smell these for me? What does this smell like? It's not gasoline, no. Can you smell this one? Not sulfur. It's lemon. It's lemon. Okay. Close your eyes. I'm going to go ahead and touch you with the pointy or the hard side and then the soft side. So you tell me if I'm touching you with soft or hard. Ready? I was touching you with the hard side. Okay, let's try that again. That was the soft side. I don't think I can do anything more for you. Hello there. I'm Dr. Gibi. Thank you so much for coming in today for your cranial nerve exam. Do you know what a cranial nerve exam is? You've never had one? Wow, that's surprising. Well, what I'm going to be doing is looking at the nerves and muscles that control your head and neck. So I'm going to sanitize my hands here, and I will be touching your face and head with my hands and some of my tools here, such as this. But if there's anything at all that you want to opt out of or you aren't comfortable with, just let me know. No problem. Is it okay to proceed otherwise? Okay, great. So we're going to get started. And we are going to take a look at your nose. So I have a few questions for you. Have you noticed any abnormal senses of smell recently? So that would be a loss of sense of smell or even smelling things that other people aren't smelling, or any changes that are typical for you? Okay, great. Great. I'm gonna have you cover and plug up one nostril and give me a deep breath in. Out through your mouth is fine. And then cover the other side. Deep breath in. Okay. Did you notice any difficulties breathing through either side? Any pain or discomfort? Okay. Wonderful. Wonderful, wonderful. I'm going to be swabbing a few smells for you. So you can cover one side again. Give this a smell and let me know if you recognize that. You can smell it, right? Okay, that was lemon. Now you can cover the other side. And give this a smell. That was peppermint. Okay, one more. All right, and you can go ahead and uncover both nostrils for this one. Give this a smell. That one is coffee. Good job. Great. We can move on to your optic nerve. Have you noticed any problems or changes in your vision? Fantastic. Now, do you normally wear glasses, contacts, or have you had any corrective surgery in your eyes? Okay, great. I'm going to have you cover your eye, and I want you to let me know what is the lowest line you can read here on the chart. Can you read that for me, left to right? Wonderful. Go ahead and cover the other eye. And let me know what is the smallest line you can read on this chart. Now, can you read that from right to left? Fantastic. You can go ahead and uncover your eyes. Next, we're checking for color blindness. I have my Ishihara plates here, and I'm going to flip through a few of them. And I just want you to let me know what shapes you can see, okay? Okay. Plate number 1. Do you see any shapes? An X and an O. Awesome. How about here? Can you see any shapes? An O and an X. Wonderful. Do you see any shapes? A triangle and a circle. Fantastic. Do you see any shapes? Circle and a triangle. Very good. Do you see any shapes? A triangle and an X. And do you see any shapes? The X and the triangle. Very good. So I don't notice any problems with your color vision, but I do have one more color test that I want to do. So I just want you to cover one eye, okay? And take a look at this tip here. What color is that? Red. Fantastic. Now cover the other eye What color is that? Still red. Okay. Now you can swap back and forth on your eyes if you want, but is this the same red that you saw with both eyes? Just both? Doesn't matter if you're looking with your left eye or your right eye. Does it look the same intensity red, the same saturation, same tone? Great. Perfect. Then you are all set with that. Very good. Then we're going to test your visual acuity. And I'm just going to have my waggling finger come into view. You let me know when you can see it and then when it disappears again for you, okay? We can have you start with both eyes uncovered. And here we go. There. Good. And it's gone. Perfect. There. Good. Perfect. You can look right at my nose. Good. And it's gone. Very good. Good. Gone. Okay. Good. Gone. Good. Gone. Okay. Perfect. Cover one eye, and I'm going to do two at once. Here we go. Let me know when you can see both, okay? Very good. And gone. Very good. Okay. And gone. You can cover the other eye now. Same thing. Good. And gone. Good. And gone. Fantastic. That was perfect. I'm going to look into your eyes with a light now. So I'm going to be getting a little bit closer, if that's okay. I will be placing my hand on your forehead so I don't accidentally bump into you. And I'm just going to take a look here. Okay. Fantastic. Other eye. Good. Okay. Go ahead and look at my nose. Okay. I'm gonna cover right in the middle. Good. Perfect. Good. Perfect. Good. Perfect. Wonderful. Your eyes are reacting very well to my light, exactly how I want to see them react. So that is great news. For the next test, I'm going to have you take a look at the wall behind me, and I will have you shift your eye focus. So first, I want you to focus on the top of this pen. Okay? Focus on the top of this pen. Very good. Now, can you focus on the wall behind me? Good. Very good. Now, back to the pen. Back to the pen. Fantastic. Have you cover your eye and do that once more. Keep focusing on the pen. And now focus on the wall behind me. Perfect. Back to the pen. Back to the pen right here. Okay. Good. Okay, cover the other eye. keep focusing on this pen. And now on the wall behind me. Great. And back to the pen. Okay, perfect, perfect. Very good. You can uncover your eye, and the next test, I'm going to go ahead and dim the lights. Okay. And for this one, I'm going to get close again. I'm going to be looking at the back of your eye, which just means I'm going to get close and shine a light in there. Nothing uncomfortable. I'm going to put my hand on your forehead again. And go ahead and look up for me. Good. Look to the left. Look to the right. And look down. Perfect. Other eye, same thing. You did amazing. Go ahead and look up for me. Look to the left. Look to the right. And look down. Perfect. Great. Your eyes look superb. Go ahead and turn those lights on for you again. All right. Okay. Final test for your optic nerve. I want you to follow my finger just with your eyes and not move your head, okay? Go ahead, cover that eye. Okay. Any double vision? Good. Go ahead and look at my nose. Any double vision with my finger while you're still looking at my nose? Okay, great. Cover the other eye. Follow my finger without moving your head. Any double vision? Okay, great. And look at my nose while I move my finger. Any double vision? Okay, wonderful. Now I just want you to have both eyes uncovered. Go ahead and follow my finger. Any double vision? Good. Follow my finger. Any double vision? Great. Your eyes are moving together and smoothly. I like what I see. Okay. So we just have to test the corneal reflex, and it sounds a lot scarier than it is. I'm just going to get close to your eye with this cotton swab, and I just need to see that your eye reacts to it. So you can actually look to the side. Okay. Good. Perfect. Look to the other side. And that's it. Perfect. Okay. Now for your face. I have a small wooden stick here. You can kind of see it is like mildly pointy, but not very pointy at all. I'm going to go ahead and tap your chest with it just so you can see how it feels, okay? Could you feel that? Very good. Off to a perfect start. I'm going to have you close your eyes, and I'm going to be tapping different areas of your face with this wooden tool. All I need you to do is let me know when you feel something. You can just say yep or whatever you want. All right, close your eyes. Good. Good. Perfect. Good. 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 Got it. Fantastic. You can open your eyes. Next, I'm going to be using this very flat and dull, almost sponge brush. Okay, so it's going to be a less concentrated poke, than the wooden stick here. I'm going to touch your chest with it first. Did you feel that? Okay, great. Close your eyes again, and we're going to do the same thing, just with a different tool. Okay, here we go. Let me know if you feel this touch your face. Good. Perfect. Yep. Very good. Very good. Fantastic. So I don't notice anything there. You're not missing any sort of sensation in your face. If you have any sort of numbness or dullness, or even like having different parts of your face feel more sensitive or less sensitive than the other, definitely let me know. But everything seems to be, it felt equal. Good. Wonderful. Okay, I'm gonna have you do some movements for me so I can check that all of your facial muscles are working and that they're both symmetrical on either side of your face. I'm gonna have you bite down. Good. Bite down again. Perfect. Okay, great. And then I just want you to move your jaw side to side. Wonderful. That felt great. And open your jaw and relax. I'm going to place my 2 fingers here and tap on your jaw. Great. No adverse reflex or anything like that. Now I'm going to have you raise your eyebrows as high as you can. Good symmetry. And then close your eyes. And then close them a little bit tighter. Great. You can open your eyes. I want you to show me your teeth. And relax. And then puff out your cheeks. And relax. Wonderful. Okay. I'm going to move on. And what I'm going to do is make a noise by your ear. Okay. And whisper a number at the same time. It's going to sound like this. And I'm going to whisper a number. 63. What number did I say? Good. Okay, once again. 47. What number did I say? Very good, very good. And now I have this brush here, which also makes quite a distinct sound. What I'm going to do is move behind your head, and I want you to let me know when you start to hear this sound and when it goes away. If you could raise your hand on the side of the head that you're hearing it, that would be perfect. Great. And then once you stop hearing it, you can lower your hand. Okay. Good. Perfect. That was both sides. You did great. A little tricky on the last one. Okay. That means we are down to the final 2 nerves. I'm going to take a look inside your mouth. I just need you to say ah. Ready? Go ahead and open and ah. Great. Perfect. You can relax. Everything looks good in there. And I want to check your vagus nerve that's responsible for you swallowing. So I have a cup of water here. You can and take a sip of it. There you go. And just swallow. Wonderful. Was there any difficulty swallowing, any pain, or does it feel swollen in any way? That's what I like to hear. Do you ever cough after you eat or drink? Great. Okay. All right. I'm going to put my hands on your shoulders, okay? Now, I want you to try and shrug up at me, and I'm going to try to hold your shoulders down, okay? Here we go. Go ahead. Good job. Perfect. Now I'm going to put one hand on the side of your face. Go ahead and try to turn your face into my hand, and I'm going to try to stop you. Good. Let's do the other side. Go ahead, try to turn your head into my hand. Perfect. Very good. Okay. Lastly, I want you to stick your tongue out at me. Go ahead, you can do it. Great. I see symmetry and no unusual movements with the tongue there. And can you push your tongue to the side of your mouth? Good. And do the other side. Good. Perfect. Okay. So I have found 0 abnormalities during your exam. Everything looks very good. If you have any questions before we're all finished, I can answer anything for you. All right. Otherwise, I will see you at your next appointment. Thank you so much for coming in. And I hope you have a wonderful rest of your week. Bye. Hello. I'm Dr. Gibi. Nice to... Oh my God. Are you okay? Wait a minute. This chart. I've seen you before, haven't I? 2 times. I had to change professions because of you. And now you're here. I don't know if I'm ready for this. Are you? Okay. Welcome into your appointment. I will be doing an orbital exam today. How are your orbitals lately? Oh, I see. Okay. Just remind me your date of birth. Okay. And, did you have any conditions that I should be aware of? Slow down, please, slow down. Gastric, what? Pulmonary, okay. 4 times, okay, 4 times. And you were hospitalized for how long? Okay. Temporary blindness. Okay. Fake teeth. I see. They removed that. Then they put it back. Then they removed it again. Okay. Noted. Got it? Okay. Alright. Is that it? No. Okay. And asthma. Alright. I'm a little afraid to ask you what medication you're taking. You already submitted the binder to the receptionist. Okay, great. Thank you. So, what brings you in today? Really? Well, that is terrible luck, isn't it? Mm-hmm. And they brought you straight here, not to the emergency room. Sure, why not? Okay, well, no problem. I am indeed a medical professional, and I will be able to treat you. I just have to run a few tests first. They're very simple tests. The first one is just examining your face. I don't love what I'm seeing, if I'm being honest with you. No, I don't. Let me put on some gloves. Why don't I? We don't really want to contaminate. Rings over there. How are you speaking right now? Medical history. Interesting. Alright. Well, seems to me like you're in good spirits. So, it's actually a little unsettling. Let me just clean off right here. Does that hurt? Kind of tender, swollen. That makes sense. Okay. Just give that a little wipe. Little wipe. Now, the first thing I want to do is get some measurements. There's a lot of protrusions, 3D things that really shouldn't be 3D, and I'd like to wrap my brain around that, if I'm being honest with you. So, if you could just look ahead. Well, that shouldn't be that. Okay, well, what about this here? Just get a little measurement. And this? Heavens. Okay. You know, the medical journal called me after your last appointment. I had about 3 months. 3 months worth of meetings. Okay. Oh my. That shouldn't be mathematically possible. Let me just get. Perhaps it's user error. No. That's correct. Well, it's not correct, but you know what I mean. I'm gonna have to bring out the big boy. And this is going to be to measure between your pupils. So, look straight ahead. Try not to move. Just gonna inch this closer. Okay. All right. Don't really know what I was expecting. Okay. Let me just look at your pupils really quick, why don't I? Take this light here. I want you to look behind me. Just going to see if your pupils. Oh, they shouldn't be doing that. Oh, oh my god. Oh, interesting. Okay, look behind my other shoulder. What? Oh my. What am I even looking at right now? I see. Okay. I would like for you to follow the light, alright? See this light right here? Can you see it? Alright, we're going to start right here. And just follow the light. It's going down, 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 down. It's going to the side. Going to the side, you're right. Up, 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 up. There you go. There you go. Oh, oh, you lost a little. You're losing it. You're losing it. Back to the middle. Okay. We're going to go over, over, over. Come on, come on. Bring it over, bring it over. And up. And down, 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 down. Stay with me here. Stay with me. Okay. Back up. And over. Back to the center. You're not even trying anymore. Okay. Follow the light down and up, down and up, down and up. That was terrible. You know what? Let me just use this here. Okay. Hold it. Cover your one eye. What color is this? Red. Okay. Okay. What if you cover this eye right there? Alright. Here. You already covered that eye. Good catch. Same marker. What color is this? Green? Well, the marker was blue, but you saw red with one eye and green with the other. Alright. Guess let's try that again. Okay. Let's cover this eye again. What color is this? What color? Yellow. How certain are you on a scale of 1 to 10? Well, if I cover this eye, same marker, what color? Blue. Well, I don't really know how to tell you this, but that one was the green one. You see green? Both eyes open, you see green. Okay. Interesting. Let's test out this discrepancy here. Cover your eye. Now, I want you to look at my nose, okay? Look at my nose. And tell me how many fingers I'm holding up, okay? How many fingers? No. 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 Unfortunately, you got none of those. Let's try it over here. Okay. Look at my nose. Look at my nose. How many fingers am I holding up? Not quite. No. Close. Kind of. Okay. Now, without covering your eyes, look at my nose. How many fingers am I holding up? Add them together. A little bit of math here. No. Nope. Let's test your peripherals then. So, again, if you keep your eyes here, I'm going to start with my hands like this, and I'm going to wiggle my fingers. You need to tell me when my hand is out of your peripheral vision. You can't see it anymore. Ready? I go a little slower. Eyes on my nose. There. Maybe my gloves are distracting me. Let's try this again. There. Okay. And there. You do not seem to possess peripheral vision. Have you ever had it? Okay. You're not even quite sure what that is. Okay. Good to note. Let's just have you read the chart back here. Okay. Take this again. There you go. Cover your eye. And what I'm going to do is just point some letters. Try this one again. This one, right here. That's okay. That's totally fine. You know what? I have a good idea. Why don't I get out the kindergarten test chart? Maybe that will be a bit easier for you. So we'll start down here. What do you see? What do you see right here? And this? What about this? Okay, let's try easier line. This. We'll go up a little. This one. What's this? What does that look like to you? What about this? No. No. Can you tell me what this is? Of course you can't. Okay. I have a few more tests. Now, I actually need to listen to your eye. It may sound a little odd, but there is indeed something for me to listen to back there. So I just want you to close your eyes, okay? Close your eyes, and I'm just going to take a listen. You don't have to breathe or anything. Well, definitely breathe, but you know. Whoa, 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 whoa. It's like a rave in there. Okay. Interesting. It's like a top hits. Let me take a listen to the other side. Okay. Let me take a look. Close your eyes. I can't hear anything. Is that... Shh, 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 shh. I could not hear anything. And the other side sounded like Ultra Music Fest. Okay. No, that's not normal. Not in the slightest. So let me get the pressure on your eye here. It's gonna get pretty close. Just try to keep your eyes open as much as you can. And I'm just gonna get this close to your eye and a little puff of air. It's gonna measure the pressure in your eye. Okay, ready?
broken. Something wrong with this. Switch a little. Okay, one more time. Look right ahead. Okay, let's measure the other one. Stay still, stay still, stay still. Okay, well, I am not too pleased with the pressure. The numbers I'm getting back are alarming at best. The fact that your eyes are still solid and not liquid is making me question basic chemistry. So I'm gonna need a little sample. Alright, so I'm gonna put the gloves back on for this. Just one glove, I think, is all I need. And I'm just going to have you look up, and I'm just going to right there. Thank you. And then the other eye. Look up, look up, look up. Okay, I'm going to send this off to the lab. I will warn them that it's coming. They're going to give me a call. The CDC will probably get involved. And I'm just going to have you can just book the rest of the appointments that I have for the week. Hey, Matt, I need you to cancel all of my week's appointments. Mrs. Jones will have to suck it up. No, this is beyond an emergency. Go home to your children, Matt. I will see you tomorrow. Thank you. All right. So, do you have any questions for me? Why? I don't know. I'm not really sure. But to be honest with you, I'm not going to be able to run any more tests until I get some results back. So that is why I'm going to need you to come back in tomorrow and probably the next day and the next day. Okay. Well, for tonight, I guess just drink some water. Yeah, drink some water, lots of rest, and I will see you tomorrow, okay? Good luck. Good luck. Hello! Oh my gosh, you're back. How are you? Are you okay? Our last, examination, that was rough, wasn't it? I still wake at night frequently thinking about your case. Well, good to see you again. How's the family? Okay. What brings you in today? It could be a myriad of things, I'm assuming. You hit your head? Oh dear God. Okay. Do you mind if I take a look? I'm just gonna examine your head. Oh my God. We're gonna have to run some tests here. It's possible that you may have damaged some of your internal systems. I think we should probably run a full cranial nerve exam on you today to sort of see where you're at in terms of basic functionality. Alright. So that means we're going to be testing your sight, your hearing, your smell, your taste, your sensation, your ability to feel. Have you noticed any issues with anything regarding those things, your sight, problems with your sight, your hearing, you're having problems with your hearing, your smell, your sense of smell, you're having problems with that, your sense of taste. Okay, and any loss of sensation? Yes, okay. Oh, all right. I'm gonna have to do all the tests I have on you then. Starting with your sight. We're gonna have to just jump right into it if we want a hope and a prayer of getting this done today. All right. The first thing I'm going to do is I'm going to look into your eyes with this light, okay? So I'm going to go ahead and stare at my nose. My nose, stare at my nose. Nope, my nose. Okay, you know what? Stare wherever you'd like, it's fine. That's weird. Uh-oh. Okay. Well, that's not good. No, it's not. Ooh. Oh God. Okay. Well, I don't think I've ever seen pupils like that in all my years of practice, to be honest with you. Can I have you just follow the light across your vision? Just don't move your head. Just follow the light. Follow the light. Follow this. You're having a lot of trouble with that, huh? I'm just gonna go back the same way. Follow the light. Yeah, you were all over the place. That was terrible. Okay, follow the light, don't move your head. Just back up, back down. All right. This is my little eye test here. All I need you to do is read me some letters here. Let's start with line 4, okay? Can you tell me what this letter is? No. Okay, we'll get a little bit easier. Let's go to line 3. Let's see if you can read line 3. Okay, can you tell me what this is? How about this one? How about that one? I'm sorry to say that none of those were correct, actually. Let's go to this line. Can you read this letter for me? How about that one? No. Okay, can you read this letter for me? You can't. Okay. That's fine. It's not fine, but alright. Nobody's fairly hard. Blind patients. Okay. I'm gonna test your peripherals using this little tool. Okay? Now keep your head straight, keep your head still. I'm going to be moving this out of your sight, and you tell me when you stop seeing it, okay? Alright, here we go. You don't see it anymore? I've barely moved it. Okay, no problem. We'll try on the other side. Here we go. You don't see it? Okay, same thing, stare right ahead, tell me when this leaves your vision. You don't see it. Okay, one more time, tell me when this leaves your vision. It's left your vision already. Okay, Can you see me? Just making sure there. I just wasn't really positive about that. Okay. One more test. I'm going to take my fingers here and I'm going to move it closer to your face, okay? I want you to keep your eyes focused on my finger this time as it gets closer to you. Here we go. Try a little harder. A little harder. Okay. One more time. Focus on my finger. Come on, just focus. Focus on my finger. Focus on my finger. Okay. I don't know what I expected. Okay. That is all the eye tests I have for you. Let's move on to your hearing. Alright, for this test, I'm going to be leaning in and whispering a series of numbers in your ear. I just want you to repeat them back to me what you heard, okay? Alright, here we go. 4, 3, 7, 6, 5. Not quite. Not quite. Let's try the other ear. 6, 2, 4, 3, 1. Let's just try one number. One number, I'll whisper it in your ear, you repeat it back to me. 9. No. Okay, how about 4? Okay, I'm going to just say some basic vocabulary words, and you tell me what you hear, okay? Picnic. Sneaker. Cat. Doctor. Interesting. It seems like you're comprehending my words, but when I whisper something in your ear, you have absolutely nothing, no recognition of the words that I'm whispering. Can you not hear them, or? Okay, let me see. My other hearing test for you is I'm going to make a bit of a humming noise, pardon me, a bit of a humming noise, and then I'm going to make a second humming noise. And I want you to tell me whether that humming noise is higher or lower, okay? Here's the first noise. Here's the second noise. No. Okay. Let's try that again. Here's the first humming noise. Here's the second humming noise. Sorry, that is not correct. One more time. Here's the first humming noise. Here's the second humming noise. No, the second one is higher. You hear it as lower? That is so interesting. Okay. Well, that's all right. Let's just move on. Let's move on to the smell test. This is a fun test. Everyone loves the smell test. Okay, here we have our smell tubes. Okay, each tube has a very distinct smell that, according to our lab tests, 99% of humans that have come into our lab do recognize these scents unless there, is something wrong with the olfactory nerve. You said you were having trouble distinguishing scents or even smelling at all. Distinguishing scents? Okay. But you can smell things. All right. Well, we'll take those small victories as we get them. Here's the first smell test. Go ahead and give us a whiff. I think that's strawberries. This is actually mint. That's mint. Can you smell mint? We just smell strawberries. Okay, well, that's all right. Plenty of other ones to try. Next. Okay. Give that a smell. You think that smells like chocolate? This is actually pickles. This is pickle juice. This is pickles. Pickles. It's very pungent. But you smell chocolate. I might have to get my colleagues in here. Let's try another one. How about this one? Okay. This is a nice strong one. You think that smells like peanut butter? This is coffee. That's coffee. Coffee smell. Coffee. Okay. There's 3 more. You can get one right. Here we go. There's a nice one. Okay. Unfortunately, no, that is not Brussels sprouts. This is orange. Orange. It's orange. Unfortunately. Nope, that's not. That's orange. Okay. Let's try another one. Here we go. What does this smell like? Roses. This is pure alcohol. This should be burning your nose. It should not smell like roses to you. Okay. One more. Might as well. Yes, this is elderflower extract. Very good. Very good. All right. Whew, if you'd gotten them all wrong, I don't know what I would have done. All right. Next, we do want to test your taste. You said you're having trouble with that as well. Now, are you tasting the wrong things, or do you have no taste at all? Tasting the wrong things, kind of like the smell, huh? All right, well, I do have these taste sticks here. Each one is loaded with a different taste on it. Once again, these tastes are widely recognized in the lab in our studies, so you shouldn't have any trouble identifying them. I'm going to put this on your tongue, and you tell me what that tastes like. It tastes like leather. Like shoe leather? Like clothing leather? No. This is banana. It's banana. Okay. Second one. Laundry detergent. Nope. Blueberry. That's blueberry. Okay. What does that taste like? Tastes like dirt. Like earthy dirt from the ground. Okay, that's cinnamon. Getting closer. That's fine. Okay. Okay. How about this one? Cat food. Oh, why do you know what that tastes like? No. This was whipped cream. Whipped cream. Just light, sugary, marshmallow type whipped cream. Okay. How about this one? No taste at all? Yes, this one had no taste. Phew. Ooh, once again, you are coming in right at the end here. Okay. Next I'm going to do a little pH test of your saliva. Alright. Now, I do have a number that I am looking for in particular that would indicate health. Alright. So, go ahead and stick this under your tongue. And we're going to leave that there for a moment while I set up the next test. Okay. How's work going? You got fired. I'm so sorry to hear that. Okay. I'm going to stop asking questions. Okay, let's take that out. This color isn't even on the bottle. How is that possible? Okay, I'm just gonna write that down, I guess. Okay. I want to move on to your sense of touch, your sensation. So I'm going to use this Q-tip here, okay? This little baby cotton swab. And I'm going to use the soft and the hard side to touch different parts of your face. Tell me when you feel it. Did you feel anything? You know what? This Q-tip is absurdly small. Let's try this one. This will be much better for testing. Okay. Close your eyes. Tell me when you feel the Q-tip on your face. Do you feel anything? This probably is too. It's okay. We can use this Q-tip. This is good. This is better. Close your eyes and tell me when you feel Q-tip on your face. Okay, here we go. Do you feel anything? That's fine. We'll try the pointy side. I'm just gonna trace around your face here. And you tell me where you feel the stick, okay? Do you feel anything? Nothing? How about here? 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 Is your entire face numb? You don't feel this Did that happen before or after you hit your head? I see. Okay. My very last test for you is just to do some simple facial movements. Okay? Just to see if you have control over the basic muscles in your face. If you don't, then we need to send you for more help. I am not equipped for this. Okay. Go ahead and raise your eyebrows. Go ahead. Anytime. Just raise your eyebrows. Okay. How about furrowing your eyebrows? Can you do that? I saw a little movement, okay. Can you stick out your tongue? A little bit more. That's far. Okay. Can you puff out your cheeks? Can you smile? Oh, you got a very nice smile. Okay, we have the smile. Okay, that's good, that's good, that's good. How about frown? Well, you'll always be happy, I guess. Can you turn your head to the side? No, to the side. To the side. What about the other side? Look up. No, look up. Up. Okay, look down. That's fine. That's good. No, down. Okay, well, you can look up and down. It's just... Okay. Now I'm going to try to open your eyes. So what I want you to do is close your eyes. I'm going to try to open them. Okay. Oh, you're supposed to stop me from opening them. Okay, close your eyes again. That's fine. Just a little bit of weakness there. That's okay. Can you shrug your shoulders for me? Just put your shoulders up. Okay, I'm going to try to push them down. Oh, no. You're supposed to not let me push them down. Okay. I'm going to go ahead and give you a little bit of some medicine, a little injection here, and then I'm going to need you to immediately go see a specialist. Give them this paper. Tell them I sent you. I have a little injection of brain juice, okay? And since you can't feel anything in your face, I'm just gonna go ahead and that should help you get to the specialist. Tell them you need to be seen right away, okay? Yes, please let me know how it goes. I am gravely concerned. Alright. Well, hopefully they can give you the help that I could not possibly give you. And good luck with everything. Nice to see you again. Bye-bye. Hello. Welcome in. Yes, I will be your doctor. Well, at least one of your doctors today. So, you have a big trip coming, don't you? Well, that's perfect. If you've never ever been to Earth before, you are in for a, I wouldn't say treat. You're in for something. I'm going to be doing a little bit of a cranial nerve exam on you. And by that, I'm just going to be testing some of your facial muscles, a little bit of eye movement, making sure that your tracker is in place, and testing your pH levels, doing a little bit of measuring, and just generally making sure that you are ready for your next appointment, and then you will be ready for your trip to Earth. All right. Now let me take a look at these notes here. Okay, no major injuries. Your vitals look good.
and you got your tracker. Let me start with your pupil size measurement. We're going to see if there's any difference when you come back and when you're actually on the planet. Oh, dearie me. There we go. Go ahead and keep your eyes open. Okay. Now I'm going to use this tiny, tiny, tiny measuring tool to get in front of your pupil. It won't be touching your pupil, don't worry. You don't have to recoil backwards. And just getting the size. And the other one. Put this tool right by pupil. And okay. Now this way. Keep your eyes open. Keep looking just at one object. Either me, the background, anything. Got it? And the other eye as well. Can't have one without the other. Unless you only have one eye, then you have one without the other. Okay, okay. Perfect. I am going to scan your tracker now. Everything looks good. Looks like it is functioning normally. I'm going to give it a little scan here. Okay. Interesting. Interesting. You can see the tracker is in place, but we need to make sure it's not going to be interfering with any data that it shouldn't be interfering with. Okay. What I want you to do is keep your eyes open. I'm going to try to close them. Good. Now close your eyes and keep them closed because I'm going to try to open them. Good. Can you wink? How about the other eye? Can you blink quite rapidly? And can you squeeze your eyes shut? All right. Now go ahead and look up to the side, down to the other side. Okay. You're going to be getting a more comprehensive visual exam. There's a lot more that I don't have the credentials to test. I'm just looking at the basics here because now I'm going to need to move down to your jaws and your teeth. You need to make sure that you can handle human food, human vegetation. Early humans could actually use their teeth and nails as weapons. Yeah, it's true. I suppose you still could in a pinch, but make sure that you're taking all of the proper self-defense toolkits with you. You don't want to have to bear any fangs. Brutal. Okay. I'm going to go ahead and just feel the muscles around your jaw. Sort of palpate the jawbone here, up around your ears. You have a nice, strong chin. Okay, I'm going to hold your face in my hand like this. I want you to open your mouth wide as you can, and then move your jaw left to right. Okay, good. And can you do that for me again? Open your mouth, left to right. Okay. One more time. Okay. You are going to be just fine. Last thing is that I just want you to go like this and show me your teeth. Open up. Perfect. Give me a good bite. Okay. Do you tend to grind your teeth at all? Any tooth pain? Okay. And do you eat solid or liquid meals? Gaseous meals? Oh, okay. You're fancy. That's lovely. Okay. I'm going to move down to your neck muscles. So I'm going to very gently put my hands on the sides of your neck and just press in. I'm going to very gently feel the front of your throat and the back of your neck. Okay. Could you, for me, tilt your head forward, to the side, to the other side, and back towards the sky. Now let's do a nice neck rotation. The other way. Okay, now I'm going to take a hold of your face and head. I'm going to try to move your head. I want you to keep your head in place. Ready? Okay, other way. Good. I'm going to put my hand on your forehead here. I'm going to try to push your head back. I need you to not allow me to do such a thing. Okay, here we go. Good. All right. Now I'm going to be feeling your brows, your brow bone, the skull that lives underneath your face. All right. Now, for me, would you please raise your eyebrows, furrow them like you're angry, and if you can, give them any sort of wiggling motion. Good. Perfect. Perfect, perfect, perfect. All right, I see here you have not been measured for your helmet yet, have you? We need to protect what's inside in case of trauma, crash landing, you know. We need your travels to be safe. So I'm going to go ahead and measure around your forehead. Very good. And then I want to measure from brow to back, nape of the neck. Good. And then your ear width. Good. Very good. Okay. Now I have two more tests for you. One would be your color test. Oh, your pH test. I lied. 3 tests. Your color test, your pH test, and then your sensory test. So let's start with your color test here. I'm going to go ahead and hold up a little pen. What color is this? No, it's octarine. Interesting. Are you colorblind? Let's find out. Let's see. What color is this? Uh-huh. How about this? Okay. This? and this. Okay, you said red, orange, blue, and pink. In fact, those were Pyrend, Momoweb, Glowl, and, well, I think you're colorblind. That's alright. It seems like you actually can only see earth colors. Indeed. So, that's good to know. I will forward that information to your eye doctor. Curious, what color is this? You can't even see that. No. There's nothing wrong with you. Just interesting. Okay. Next, we're going to do a little test of your pH levels. Go ahead and get a little testing strip here. Now I just need you to open your mouth and hold it there, hold it there. Okay. Take a little look-see. PH level up. Okay. I'll go ahead and forward those results as well. That was nice and easy. Now, I'm going to wipe off your face because I want to make sure there's nothing in the way when we do these sensory tests. It's unlikely that dirt or anything would actually prevent you from feeling something, but it's just protocol that we do this. And then we're just going to let it dry. Now, I want you to tell me if what you're feeling is hard or soft. Hard or soft. Hard or soft. And that's it. That's your final test with me. So obviously I want you to close your eyes, otherwise you would cheat. And when I touch you on the face, you can tell me hard or soft. If you don't feel anything at all, that is a separate issue. All right, close your eyes and hard, 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 soft, soft, hard, soft, hard, soft, soft, hard, soft, hard. Marvelous, marvelous, marvelous. All right, well, that was as comprehensive as I could have made it. I hope you have a wonderful trip to Earth. I hear it's interesting indeed. I look forward to seeing you when you come back. But for now, I'm going to send you off to your next appointment. I will let them know that you are coming so they can see you right away. And thank you so much for your service to our planet. Autonoma is lucky to have you. All right. See you later. Hi, I'm Dr. Gibi. It's nice to see you. Could you confirm your name for me? Perfect. Okay. So we are doing a full comprehensive orbital exam today. It's going to be a little bit different than what you might be used to in terms of just like your routine eye exam or maybe your exam to get glasses or contacts. This is going to be more about your vision. So we'll do a few vision tests that you might be familiar with. But I'm going to be pressing on your eyes, around the bone structure about your body. I'm going to do a bit of a jaw check and just be checking the pressure of your eyes as well. None of this should be painful in any way. If it is, please don't hesitate to tell me, because that is something that I will note so we can look into that. All right, I'm going to start off with a few questions. Are you nice and comfortable? Okay. Have you had any recent trauma to your face? Okay. Are there any possibilities for any foreign bodies being present in your eye or possibly in your skull? You'd be surprised what we see here. Do you have any history of ocular problems, vision problems, anything that you think that I could or should be aware of? Okay. Are you on any medications, anything at all, not necessarily related to your vision? Okay. Okay. Do you have any past diagnoses that I should be aware of, or any past surgeries that I should be aware of? Yep, okay. Okay. At the moment, are you in any pain? And if you could give that a 1 out of 10. Okay. Any differences in your vision at the moment than what you normally experience? Anything that you're concerned about or changes that you've noticed? Have you noticed any swelling? Okay. All right. Thank you so much for being patient with me and answering those questions. I'm going to start off by looking for some pupillary defects. I'm just going to be shining this very bright light, apologies in advance, into your eyes. I'm going to be checking out your pupils. So I want you to stare off into the distance, okay? You don't have to look directly at the light at all. I'll be bringing it into your field of vision, but I don't want you to have to focus on the bright light. Okay. So I'll be looking at not only the pupil that I'm shining the light in, but also the pupil that I'm not shining the light in, to make sure that they're reacting how they should, and making sure that they're symmetrical. Okay, very good. You can go ahead and relax. Right now, I just want you to do a few exercises for me. Let's go ahead and close your eyes. Okay, open your eyes. Very good. Can you look up for me? Look down without moving your head. Look to the side and to the other side without moving your head. Okay, wonderful. I'm going to go ahead and relax. I'm going to go ahead and have you follow my finger. Just with your eyes, if you can keep your head as steady as possible. I'm going to do that again. I'm going to go ahead and hold your eyelids open very gently. Is that okay? And I'm going to have you follow my finger again. Okay, very good. Sometimes it's hard to see the eye moving down when you look down because your eyelids cover it. So we have to hold up the eyelids. Okay. So all of your positions of gaze look good, nothing inconsistent. I'm going to go ahead and get some measurements with my exophthalmometer. There's just a fancy word for measuring tool that I'll be using. So I just need you to position your head and your neck as naturally as possible. Now these points are going to go on either side of your eyes. If it's uncomfortable, just let me know, but it shouldn't be. I'm just going to need to slide this. Okay. I'm going to make a note of the measurements. Okay. And we're going to do this again. But this time, I need you to build up some vascular pressure in your face. And to do that, I basically just need you to make your face red. So have some pressure built up. So I want you to lean over. Okay, hold your nose with your fingers and blow like you're blowing up a balloon or something. Okay, now if you can just hold this for 20, maybe not even 20 seconds, I think 10 seconds is usually enough. So just hold your nose and blow. 9, 10. Okay, very good. You can go ahead and relax. A lot of people don't like doing that. I'm just gonna go ahead and get a second measurement here. Okay. Thank you, thank you. Okay. I'm gonna go ahead and check for any abnormalities or anything that we should be concerned with behind your eyes, just by having you close your eyes. And I'm going to use my thumbs to very gently just press on your eyes. I'm not going to put a lot of pressure on at all, but I just want you to keep your eyes closed and relaxed. Okay, go ahead and close your eyes. And I'm going to do both at the same time, which helps me determine if there are any inconsistencies or if it's not symmetrical. I don't feel anything to be concerned about. Okay, very good. You can open your eyes or keep them closed because I'm just going to check the bony rims around your eyes. So I'm just going to make sure that all of this is intact. No fractures, swelling, or anything that we should be concerned about. So go ahead and just feeling around on the tops. And then I'm going to go down your nose here, and then under the eyes here. Okay, I don't feel any abnormalities on the nasal bridge. I don't feel any abnormal notches or anything. It seems like you have a little bit of an inconsistency on this side. So I'm just going to note that, but it's nothing to be immediately worried about. Have you ever had any trauma to your face on that side in particular? Alright, let's
test your facial sensation. So I'm going to be doing V1, V2, and the V3 zones. I'm just going to use the backs of my fingers, and I want you to tell me if it feels the same on both sides, and of course, importantly, if you can feel it at all. Okay. I'm going to lightly touch the skin on your forehead. Did that feel the same on both sides? Okay. Next, over your nose bridge and then your cheeks. I'm going to lightly touch both sides. Did that feel the same on both sides? Okay. And then here along your chin and jawline, I'm going to go ahead and lightly touch both sides. Did that feel the same? Okay. Alright, next we are going to be checking your facial strength, checking for any facial nerve injuries, again, inconsistencies, weaknesses, etc. So that means we're going to do a couple more exercises. So go ahead and raise your eyebrows up, furrow them down. Very good. Now I'm going to ask you to tightly squeeze your eyes shut. Keep them closed. I'm going to try to open them. Keep them closed. Good. Okay, you can go ahead and relax. Sometimes when a patient has a trauma or weakness, they are unable to keep one of their eyes closed. Sometimes both, but usually what we see is trauma on one or the other side. Okay, so let's move down to your jaw. So if you just clench your jaw, does your jaw feel aligned for the most part? Okay. Do you feel any pain when you bite down? Good. Okay. I'm going to check your maxilla instability. And that just means I'm going to be putting a gloved hand in your mouth above your teeth. So up above, kind of like where your gum line is. And I'm going to very gently move my hand back and forth, like really gently. Your neck shouldn't move at all, but I'm going to make sure that there's no instability here that could be affecting the orbital zone. Okay, so I'm going to put my hand in your mouth and just very gently. Okay. Some people are surprised when we check the mouth and the jaw during an orbital exam, but it is certainly all connected. Okay. You're doing really well. Thank you so much. Are you comfortable still? Good. Okay. Next, I'm going to be putting a stethoscope on your eyelids. You ever had that done before? This is just a precaution to check for any vascular tumors. I'm going to listen for any bruits that I hear, potentially behind the eyelid. So I just need you to, again, close your eyes, and I'm going to take a listen, okay? Very good. And the other eye. Very good. Nothing abnormal. I don't hear anything that's concerning. Okay. I'm going to have you do a more typical eye test. I'm going to have you hold this in front of either of your eyes. I'm going to ask you to read this chart. So go ahead and take this,
hold it in front of. Let's do your left eye. Cover your left eye first. With your right eye, can you tell me the smallest line you can read and then read it out loud for me? Can you read this line? Okay, can you read this line? And give it your best shot. Okay, I'm gonna have you switch eyes, so go ahead and we're gonna take that one and move it to this right eye over here. So now I want you to read with your left eye the lowest line you can read. Can you do this one for me? And can you read one lower? Go ahead and give it your best shot. Okay. Okay. You can keep that on your right eye. Still with your left eye. Slowly follow the light here. Okay, very good. I'm gonna have you go ahead and switch from this eye to covering your left eye, and I want to do the light test again with your right eye. So we're gonna start in the center. Follow the light. Very good. Follow the light. Very good. Very good. And here. Okay. And then around slowly in a circle. Very good. You can go ahead and uncover your eye. Take that from you. Okay. I'm going to check your optic nerve by doing a few small tests. Now, this one I'm going to be covering your eye for you. And I want you to tell me, with this eye covered, what color pen is this? Good. Okay. Cover your other eye, and I want you to tell me, what color pen is this? Okay. Were they the same color? Were the reds different? Okay. All right. Once again, I'm going to cover your eye for you. And I'm going to move this light into your eye. Okay? I'm going to cover your eye and move this light into your eye. Was one of the lights brighter or dimmer than the other, or were they the same? Okay. Okay. Usually if one of them is or appears dimmer to our patient, we can ask, because it's a fairly subjective test, what percentage dimmer or brighter the one side was. Okay. I do want to check your peripherals, your focus, and then we're going to just test your pressure inside your eye. I'm going to give you some eye drops for that, and then we can send you on your way. You should be good to drive, or if somebody's picking you up, that's good too. Okay. So So with this peripheral check, I want you to go ahead and stare right at my nose, okay? I'm going to hold my hands up, and I want you to tell me, while looking at my nose the whole time, don't cheat, how many fingers I'm holding up, okay? Alright, here we go. Good. 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 Can you do the same thing, but with one eye covered? Okay. Here we go. Good. 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 And then, of course, let's cover the other eye. Here we go. Good. 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 Perfect. Good. Okay. Sometimes I can't hold my fingers up how I want to. Go ahead and uncover your eyes. And once again, I want you to look at my nose. I'm going to have my 2 fingers here. I'm going to be wiggling them out of your vision. When you can't see my fingers anymore, let me know. Again, stay focused on the center point. Here we go. Good. 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 Perfect. Okay, time to cover that eye. We're going to do the exact same thing. Now that you know what to expect, let me know when you can't see my fingers anymore. Now, okay. Okay. There. Right there. Okay. Go ahead and cover your other eye. Let's do this one more time. Okay. Okay. Very good. Okie dokie. Go ahead and uncover your eye. I'm going to take this red pen again, and I'm going to be bringing it closer to your face. I want you, to your best ability, to stay focused on this pen. Are you ready? Okay, very good. Go ahead and cover your eye. Okay, and your other eye. Okay, perfect. So we're going to have you slightly tilt your head backwards, and we're just going to drop and drop, and be a little cotton ball here. Okay, and let that sit for a moment. And then I'm just going to be getting a pressure reading. I'm going to very, very, very lightly touch the surface of your eye. These drops should make it so you don't feel a thing. Okay, let's go ahead and look straight forward or wherever you're comfortable. And I'm just going to. Okay. Very good. And let me write down that reading. Now for your other eye. Okay. Let me write down that reading. Okay. Now I want you to look up, okay? We're going to do the same thing. Okay. Look up and let's do the other eye. Okay, very good. Okay, that got well again. Alright. Now, do you have any questions for me? You should have your results soon, and then if I need to refer you to another doctor, I will, and I can just give you a call, or does email work better? Okay. Alright, well, thank you so much. It was a pleasure to meet you, and I hope you have a wonderful rest of your day. Thank you so much for coming in. Okay, bye-bye.
Well, hello there. Welcome. This is your first time coming to this office, I assume? Okay. Yes. Usually, we prefer nighttime appointments, and I can't really turn the lights on, so I just use this lantern. Well, I have to be honest with you. I'm not exactly a cranial nerve doctor yet, okay? And I was just wondering if you would maybe like to be my first patient. Well, I don't even think that you really need a degree for this. You can just kind of do it. Well, I already locked the door, so nobody will interrupt us or anything, so really it's just easier for you to stay. No, we don't have any other doctors here right now. It's very late at night. Well, I'm not sure why you went and took a nighttime appointment for a cranial nerve exam. If you wanted one of the professional doctors to do it. Oh, no. This isn't breaking and entering or anything like that. It's just, I know one of the doctors who works here, and I used to be a receptionist, but no, not anymore. But she probably, wouldn't even be that mad if she knew I was here. So let's just go on with your appointment, and if you think I did a good job, maybe you could call back here tomorrow and tell the doctor that I did a good job. Okay? I promise it's gonna be just fine. I have watched her do hundreds of cranial nerve exams, and to be quite honest with you, it doesn't look that difficult. So, well, let me walk you through the basic steps if I can remember them. So, you want to test the cranial nerves in your noggin right there. So, you want to do taste, smell, hearing, and touch. 1, 2, 3, 4, 5. That sounds correct to me. Okay, great. Well, let's get started. I'm going to need your information since, you're a new patient for me. Okay, so what's your name? That sounds very familiar. Maybe you were here when I was a receptionist or something. And what's your birthday? What do you want for your birthday? Well, birthday is the best holiday of the year. It's a holiday about you. Okay. So, have you been having any trouble? And what side of your face? This one? Okay. Well, we can certainly test that. I would be honored to. Okay. And are you allergic to anything? Okay, so no latex. Okay. And how often would you say that you get 8 or more hours of sleep? Okay. You need to work on that. I'm not gonna lie to you here. I'm very honest, very upfront. And do you drink? Smoke? Party? Okay, that last one's not usually a question. You just look like the type of person who maybe would, I don't know, enjoy a good party. Nothing wrong with that. As long as you come in for your regular checkups with your almost professional doctors. Okay. So what I'm going to do now is start the tests. All we have to do is look through these different ones. So the first one is taste. And I found some equipment that, wasn't quite locked up, so we're gonna go with it. So these should be the taste sticks. So what you want to do is open your mouth, and I'm gonna put this under your tongue. Oh, does that taste bad? What is that? Oh, I think these are the smell sticks. I'm so sorry. I don't have any water. Just it shouldn't be poisonous or anything. Sorry about that. They look the same. Okay, well, maybe we'll just skip the taste. You tasted that fine, so I have no reason to believe that there's anything wrong with you. Okay, so let's move on to smell since we're right here. Okay. Forgive me if I'm a little nervous. Okay. This is the first one. Okay, I know what that is. Let's see if you guess it. Really? I thought it smelled like peanut butter. I guess I can see that. Alright, well, I'll give you a half a point. Next up. Okay. That's right, that's strawberry. Okay, you got it. Very smart. Next stick. See, I don't have them memorized yet, but I'll get there. Okay, I think I know what this one is. I don't know. One more time. You think that's chocolate? Alright. I can see that. That could be a possibility. And last one. Oh, easy. Lemon. Well, you got 3.5 points. That means you can smell. Okay. So I will put these smell sticks away for now. Let's see. Check. Next we have sight. Okay. So I'm going to do a couple little tests with you. The first one being follow the light. I'm going to turn this off for now. And what I want you to do is follow the light with your eyes. Move this out of the way. Oh no, keep following. You're good. Keep going. Well, your eyes seem to be following the light and everything, so maybe I'll make it a little bit more complicated for you. Ready? Okay. I am impressed. I am impressed. Now, I'm supposed to look into your eyes and see if they change when I get close with the light, okay? So go ahead and look straight at me. Okay. Sorry. And the other eye. Okay. Well, your eyes did the thing. Eyes can move and do big things. I think they call it your eyes were dialing just fine. Now what I'm going to do is give little bursts of light, okay? So you let me know if I'm seeing anything bad in Morse code, okay? Alright, so you passed the light test. Next, all I want to do is do some of the finger tests, which essentially is sort of the same. I don't know why you have to do both, but you know, all I want you to do is follow my finger, and then I'll do some number tests with you. So here we go. Would you say this is easier or more difficult than following the light? Okay. I was just curious, I'm gonna go a little bit closer to you, okay? And back out. And in. And out. In. Boop. Sorry. Okay, sorry. In. Out. Good, good, good. Now, you need to look right at my nose. I'm gonna hold my hands up, and you let me know which finger I'm wiggling, okay? Here we go. This one. This one again. This one. Sometimes it's like when you get 3 C's in a row on a multiple choice question. I gotta test you. Good. Both. Alright. And now the same thing, but with numbers, okay? So, I'm gonna hold up some numbers, but don't look at my fingers. Look right here. Okay. 3, 2, 4, 1, 2, 2, all 5. All right. Fantastic work. So have you noticed any blurriness, any difficulties seeing? Nothing? Alright, well, good thing we did all those tests then. I'll give you an A+. I don't know if they do report cards here, but it always feels good to get an A+. So, sight, check. Next I'm gonna do hearing. So, the hearing test is pretty easy. I want you to close your eyes, and I'm gonna say something in your ear, and you have to tell me what I'm saying. Okay? Here we go. Opossum. Opossum. Very good. Next word. Justice. Justice. Fantastic. Linoleum. Linoleum. Perfect. One more. Rebel. Rebel. A+. Now I'm going to do a very similar thing with my fingers, so you have to tell me what side you're going to hear this from, okay? Whether it's this side or this side. So, are you ready? Here we go. Close your eyes. Close them. Good. Fantastic work. So, your hearing seems to be just fine, to be honest. I don't have any of those fancy looking in your ear type tools, and to be honest with you, I don't know what I would do. I don't really know what I should be looking for yet. Hopefully that will come with practice, but for now, we can turn our light back on. Ooh. I think a spider died in there. Ooh, well, you know what they say. Sometimes I just say things without thinking. Put that there. So, your hearing's alright. Now we're going to move on to the most exciting part of the test, which is touch. There's actually quite a few things that I would like to go over with touch with you. And the first one is the more traditional. I'm going to poke your face and you're going to tell me if you feel it. And then I want you to do some very easy tasks for me. They should all be an A+. Just moving your face muscles and your shoulder and neck muscles. I'll just take a look and make sure they're all okay. Okay, good. So, alright. Oh, you're allergic to latex. That's right, we did write that down. Don't worry about it. Are you alright touching without gloves? Okay. I'm just gonna use a little bit of this. I don't want you getting any hives or nothing at my doctor's office. Well, soon to be mine. First, I'm going to touch your face with my hands. So, I'm just feeling for anything abnormal. Do you feel abnormal? Well, sometimes I do, but you look alright. Okay. And your forehead. I'm just doing some light drumming. Okay. Alright. You feel just fine. So I'm going to do a test now. And this involves me using a pointy stick on your face. So I've got this pointy stick and I'm going to take a little bit of plastic off. And you're just going to close your eyes and I'm going to touch you with the pointy end and you let me know when and where you feel it, okay? Okay. Close your eyes. No cheating, alright? Okay, here we go. Good. 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 Mm-hmm. Okay. Oh, I'm so sorry. That was a little bit harder than I anticipated. This is really pointy. Are you bleeding? Okay. No, it's okay. Remain calm. You are totally fine. I just wanna maybe take a look at that. Oh, I'm sorry. Does it hurt? Yeah, okay. That's too big. Okay. Please don't mention this in your review about me. I promise it's just a little one. Well, let me clean that off a little bit. I think this is some cream that will stop. Okay. Does that sting? Sorry. Well. Okay. Put that Band-Aid on there. mistake on my first go. Not so bad. Well, you get an A+ for feeling, so that's good. Are you mad at me? Okay. Should we continue on with the test? Really? Okay. Okay, I promise. I'm putting the pointy sticks away. A bad stick, you know. They really should not have these out for anyone to grab, you know. That is dangerous. Alright, so now I'm going to be checking you out a little bit. Okay. So first I want to do your reflexes. So that's going to be, can you give me your arm? I promise. I won't do it that hard. Am I hitting the right spot? There we go. Okay. Other arm. First try. Now I'm going to do your knees, okay? Good. Your other one. Good. You have reflexes. A+. Now what I'm going to do is get a couple measurements. So what you want to do is be in the average percentile. If you're lower or higher, sometimes that is, you know, it's telling of something else. So we just like to get measurements so we know what to look for. So let me measure your face. A+ face. Okay, good. Side. Okay. Let me measure the distance between your eyes. Perfect. And your nose. It's about a 1/4 inch. Okay. I'm going to measure across your neck. Very good. And I'm going to measure the top of your head. Okay. Now, can you make your shoulders nice and straight? Alright, very good. I'll give you an A for that one. Oh no, no problem, no worries. So, can you puff out your cheeks for me? How about stick out your tongue? Can you shake your head no? Shake your head yes. I'm the best doctor you've ever had, aren't I? Okay, you can stop shaking your head yes. Very good. Can you turn your head this way? This way? Good. Now, I want you to close your eyes really tight. And I'm going to try to open them, okay? Here we go. Oh, your eyelids are so strong. Very good. Now, I want you to scrunch up your nose. Good. And I'm going to press down on your jaw. So, I want you to keep it shut like this. And don't let me pull it open. There we go. Very nice. I think you could win some jaw competitions. Oh, there's jaw competitions everywhere. It's not that weird. Okay. I'm going to press down on your shoulders. Very nice. Very nice indeed. A plus. Can you extend your arms forward like this? Okay. And flip your palms. You have a nice lifeline. And dabble as a palm reader. Okay. Other hand. Very good. 4 fingers, 2 thumbs. A plus. Next, what I would like you to do is, did you hear that? I think maybe it's time to leave. I think overall you got an average of A plus, so if you would like to come back tomorrow and let the doctor know that I did a good job, that would be very appreciated. Okay, I think we are all done here. I will unlock the door and we can make a very quiet and swift exit. Sound good? Okay. Thanks for coming in. I'm Dr. Daisy. Don't forget it.
Hi there. I'm Dr. Gibi. Thank you so much for coming in. Is this your first cranial nerve exam? No, but first time here? Okay, that's what I thought. So did the receptionist get all of your information? Good. Okay, did you have any other questions before we begin? This is your standard cranial nerve exam, except this one is a bit longer, it's more detailed, and I really like to take my time and fully examine all of my patients so that there's no returns where I might have missed something or you didn't have enough time to ask me questions that you wanted to ask, stuff like that, you know? Okay. So this exam will be pretty thorough. I want to go through all of your basic nerves. Yes, there's nothing painful, nothing scary, and I will let you know what I'm doing every step of the way. That way you'll feel comfortable and know what's going on. Right. So these tests are just simple to see if there's any nerve damage, either in your nose, your eyes, your ears, and I'll also be checking your facial structure, your muscle movements, as well as I'd like to give you a small head massage near the end, and I just want to measure your calm heart rate as opposed to I'm going to get your heart rate in the beginning and record that, and then I will get it at the end where hopefully I can get you into a relaxed state. Does that sound good? Okay. Well, first I'm going to clean off your seat. I want to make sure that things are sterilized. You don't want any false reports or spreading of germs. So the nurse should have cleaned it when the last patient left, but I like to clean it in the middle as well, just in case anyone wandered into the room for any reason. So should be good to sit down now. Okay. And let me sanitize my hands. Okay. Now, I want to start with listening to your heart, and after that, I'll move on to your olfactory nerve, but I do want to get the initial heart rate recorded so that we can record your beginning and your end. Great. Can you breathe in and out with me? Again. 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 And I'm gonna go behind you. Again, breathe in. And your other side. Breathe in. Okay. So your heart rate is very good. It's a bit lower than average, and low is good. It means you have a strong heart in most cases. So I'm just going to record your initial heart rate. Okay. Now we're going to check your olfactory nerve. That's just your smell. And I have with me a few bottles. And they have the little tubes at the end, and I'm just going to dip the tube in and have you smell it. And I just want you to tell me what it smells like. They should be pretty recognizable smells, but don't worry if you can't get one or two. Okay, here we go. Okay, smell. Do you know what that is? Peppermint. Good job. Okay. What's the next one? Can you smell that? And that smells like oranges. Very good. Most people guess lemon just because of the citrus aroma. It is oranges. Good work. Okay. I'm gonna move into the bitter smells. Can you smell that? Coffee. Nice. And how about that one? It's a little tricky. Here. Try that again. Vanilla. Good, you got it. Don't worry. Okay, and this is a bonus one. Can you smell this? Do you know what that is? lock in. Perfect. Good job. So I'm going to put these smells away. I'm just going to do a physical examination of your nose, just the exterior. So I'm going to slap on some gloves. And I do have latex gloves. They're disposable, they're powdered, and yes, single use. Are you allergic to latex? No. Okay. Great. So I'm going to my gloves. They're a bit snug on me. Okay. Now I'd like to take a look at your nose. So just, oops. Look right at me. Okay, that looks good. I don't notice anything. I'm just gonna get a light and look up just to make sure there's nothing damaged down the inside. Let me find my pen light. Here we are. Okay. Now, just look up for me again. The other side. Okay. It all looks great, of course. Now I just want to do a taste test. Very linked, your smell and your taste, so I'm sure this will be quick for you. You got them all correct. So I have, or should have, I have taste sticks with me, and I'm going to dip these into different liquids, liquefied versions of taste that you should recognize. Okay, so I'm going to open your mouth. Do you know what that is? Peanut butter. Good. Open, close. How about that? Chocolate. Very good. And open your mouth. Okay. Strawberry. Okay. Just one more, okay? Open. Mint. Perfect. Okay. So now I want to do an eye exam. So I just have very basic eye chart. I've made a custom one. That has the letters that people most frequently mistake for other letters. So I'm just going to hold it back here, and if you could tell me what letter I'm pointing at. I'll get a little pointer stick. Okay, ready? And I'd actually like for you to cover one of your eyes while you do this, and then we'll do the other one. Okay, great. Okay, cover that one. Okay. Oh. V G W M L C. Okay. Now can you cover the other one? Alright, I'm going to point at some different letters. D Q C W. Little one down here. P. Good job. And I'd actually, I'd like to test you for color blindness today. I have a few colored pens. I'm just going to lift one up and you let me know what color it is, okay? Alright, here we go. Orange. Pink. Blue. Green. Okay. Now can you tell me the colors in order? Green, blue, and backwards. Good work. Alright, I seem to have dropped my chart. Okay, let's see. I'm going to test your visual fields, and that just means that I'm going to put 2 fingers on either side, and I'd like for you to look at me right in the middle of the face. You can look at my notes if you wish. And what I'm going to do is wiggle one finger and let me know which finger it was. Okay, here we go. Eyes on me, right here. Good. Perfect. Good. Okay. Both. Mm-hmm. Good. Okay. Good. That was a little wiggle. Good job. And I'm going to do almost the same thing. What I'm going to do is I'm going to bring my fingers apart, and when they leave your peripheral vision, you just tell me when. Okay, here we go. There. Right there. Good. 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 And I'm going to be wiggling them now, okay? Same thing. Okay. Right there. Okay. Great. And in a similar vein, I'm going to hold my hands up and you let me know how many fingers I'm holding up. This is a tough one, but make sure you keep your eyes right here. Okay, great. Ones. 2, 4, 5, 2, 2. Ones. Wonderful. I'd just like to. Okay. I'm gonna find my pen light again. And I just want a closer peek in your pupils. Okay. Just gonna get a little bit closer. Now, if you would, could you hold your hand like this? Yeah, right in the middle. Good. Very good. And I'm just going to do you can take your hand down. I'm going to do a follow the light. Pretty simple. Keep your head in one spot. Just follow where the light goes with your eyeballs. Okay. Good, yes. Can you follow it close again? And once more. Okay. And I want to do that again, but I'm just going to do it with my finger instead of the light. Because you can follow my finger this time. I'd like you to cover one eye. Okay. And the other eye. Wonderful. Now I just need you to do some blinking. So can you blink rapidly? Good. Now how about a slow blink? Blink. Blink. Now can you shut your eyes tightly? Good. And can you wink? Can you shut one each eye? It's often harder on one side than the other. Very good. Now what I'm going to do is I just have a Q-tip in my bag. There we go. And I'm going to touch the sides of your eyes. And you can keep them closed and tell me when I touch your eyes, okay? Ready? Right there. Mm-hmm. Very good. You can open your eyes again. And I'm actually going to be doing this to your entire face. What I want you to do is tell me when you can feel the touch. And I'll be doing it with a dull object first, and then a sharp object second. It's not very sharp. It's just a little bit more specific feeling than the rounded Q-tip. Okay, so close your eyes. And I'll be touching your face with the Q-tip first, okay? Here we go. Okay. Good. Perfect. Good. 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 Perfect. And now I want to do this with the sharp object, so keep your eyes closed. Good. Perfect. Good. Very nice. Okay. Good. Good. Wonderful. And now that you know how they both feel, I'm going to do one or the other, and you let me know which one I used, okay? Okay. Close your eyes. Dull. Good. Dull. Sharp. Sharp. Dull. Sharp. Both. Sharp. Dull. Sharp. Both. Both. Now, when you said both, where was the dull one? Here? And where was the sharp one? Here? Perfect. Okay. So I'm just going to ask you to do a couple of silly things for me. What I want you to do is open your mouth as wide as you can. Good. Now I'm going to try to close your jaw, and don't let me close it, okay? Very good. You can close your mouth now. And can you clench your jaw? Mm-hmm. Good. How about showing me your teeth? Good. And can you smile? Very nice. And smile again. Okay. And can you frown? How about pout? Stick your lower lip out. Good. And can you puff out your cheeks? Good. Okay. Now I want you to look up, and I want to see those forehead wrinkles, okay? Ready? Good. All right. Okay. So, I'm getting out my other light. And I would just like you to open your mouth and say, okay. Good. And I'm going to test your gag reflex very gently, don't worry. Open your mouth. Okay. Okay. All good. Thank you. I know that can be uncomfortable. Okay. Now I want you to shrug your shoulders. Up, down. Okay, let me feel. Up, down. And can you cross one arm over here? Cross one arm over here. And squeeze. Keep squeezing, keep squeezing, keep squeezing. Good job. Okay, you can relax. And I'm going to try to turn your head, and I would like you to not let me, okay? Okay, try again. Ready? Better. And the other side? Good. Very good. You weren't expecting me to be so strong, I know. Can you stick out your tongue for me? Can you roll your tongue? You don't have to be able to do that. Alright. Now, I'm going to take a peek at your ears. Okay? And I actually have my it was right here. So we have the pen light. What I'm going to do is put my attachment on there, and this is just going to go right in the shallow part of your ear canal. Okay? Do you notice any difference in hearing on either side of your ear? Yeah, it's okay if one's stronger than the other. I'm going to be doing a simple sound test that will let us know. And what I'm going to do is put my fingers right by your ears, and I'm going to be moving them both, but I'm only going to be making sounds with one of them. So close your eyes and let me know which ear you hear it from. Okay. Okay. Very good. Now I'm going to be saying some numbers into each of your ears, and you just have to repeat them back to me, okay? Okay, here we go. 6, 3, 4. 6, 3, 4. 1978. 3, 4, 2, 9. 3, 4, 2, 9. 10, 1, 0. 10, 1, 0. I'm going to do the same thing, but with words. Just tell me what word you hear. Very simple. Okay, great. Playground. Playground. Good. Towel. Schedule. Good. Piano. Ostrich. Varsity. Varsity. No, that was quiet. Good job. All right. Great. Now, if you don't mind, I would like to take some measurements. I know it sounds odd, but you've been performing really well on the tests, and I'm gathering data on physical characteristics correlated with. Right, exactly. So I'm just going to measure some parts of your face. Good. And can you close your eyes? Okay, you can open them. I'm gonna do your nose. 3 and okay. Okay. Now I'd like you to go out to the front desk and see the nurse again. She's going to collect some DNA samples from you and give you your wellness check and report. Okay. Thank you so much for coming in. It was really nice to see you. Okay. I expect to see you in again soon. Okay, that's what I thought. All right. Goodbye. Hello, hello. My name is Dr. Gibi. I'm just gonna get some hand sanitizer here. And I just wanted to welcome you into the office today. And you filled out the patient paperwork. Awesome. You can give that to me. Thank you. Okay, so this isn't your first time here. pressure, I'm also going to go ahead and put one of these little blood oxygen readers on you. It doesn't actually pinch or anything, it's just reading your finger. It just goes on like that. And that'll stay for a minute there. And then the blood pressure cuff on the arm here. Okay. Perfect.
you to tell me how many fingers while you keep your eyes focused on my nose. Are you ready? Here we go. Good. Perfect. Perfect. Good. Awesome. Fantastic. Fantastic. And then we're going to check your peripherals. So that just means you're going to continue staring at my nose. I'm going to start with my fingers very, very close, and we're going to wiggle them away. Once you can no longer see my fingers, you can just say, okay, and then I'll know that it is out of your vision. Sound good? Okay. Look at my nose. We'll start there. Okay. Okay, good. Perfect. Good. A little faster. Yes. Awesome. Very good. You're really good at that. Alright, next I'm going to hold up some markers and you tell me what color the cap is. Okay, here we go. What color is this? Fantastic. Red. What color is this? Green. Very good. What color is this? Blue. What color is this? Yellow. What color is this? Purple. And what color is this? Pink. Awesome. So if you close one eye, okay, and I hold up this red marker again, on a scale of 1 to 10, how red is this marker? With 1 being not red at all, it appears more gray, and 10 being this appears red, very red. There's no dullness or anything to it. Okay, great. Now I'm going to switch hands and I want you to switch eyes. Again, what color on a scale of 1 to 10 is this red marker? So it's the same red on both eyes. Perfect, 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 perfect. Alright. For the eye chart, what I'm going to do is just set that up here. Okay, so as you can see behind me, there is a chart. And I just want you to read the smallest line that you can with both eyes. Ready? Fantastic. Really good. Okay, great. Now go ahead and cover one eye. I'm going to change what the letters are. Go ahead and read the smallest line for me that you can. Awesome. Okay, other eye. I'm going to change it again. And once again, which one is the smallest line you can read? Go ahead and do it for me. So good. Awesome. Alright. Now with both eyes, I'm going to show you this small card. Now on this card, what is the smallest line you can read close up? Awesome. And if you cover one eye, can you still read that line? And what if you covered the other eye instead? Good. Now, what shape is this right here? How about this? This? And this? Very good. Very, very good. Alright, that all looks awesome. For your hearing test, we'll put the headphones on for you, and there'll be a little beep, beep, beep. Slower than that, you'll hear beep, 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 something more along that line. And depending on what our food or a flavor that is made up of a lot of small components. And when you lose your taste, your brain's not identifying those components. As you start to regain your taste back, you may not gain access to all of those components at the same time. You might gain access to only a few components, and those few components might taste really bad or really not what you're used to. So that's something that we're discovering there. So for smell, which is very connected, what I want to do is have you smell 3 of these Q-tips, and one of the 3 is going to smell like strawberries. So I want you to tell me which one smells like strawberries. Is it 1, 2, or 3? Ready? Okay. Q-tip number 1. Good. Q-tip number 2. And Q-tip number 3. Now which one smelled like strawberries? Good, very good, very good. Alright, we're gonna do that again, but this time the smell that I want you to identify is coffee. So, is it Q-tip number 1? Q-tip number 2? It's like a game show. Or Q-tip number 3? Good. Awesome, awesome, awesome. Last one I have is the smell of lavender. So I'll give you 3 Q-tips and you let me know whether 1, 2, or 3 is the one that smells like lavender. Q-tip 1. Okay. Q-tip 2. Q-tip 3. Which one was lavender? Perfect. Fantastic, fantastic. Alright. So, do you smell anything on this? Okay, very good. And then I'm going to put a picture up here on the wall and then give you a smell. Another Q-tip. I want you to let me know whether the picture and the smell are the same, whether they go together or not. Alright, so we have a picture of firewood. Here's your Q-tip. Does the smell match the picture? Good. Okay. Picture of a lemon. Does the smell match the picture? Good. And then a picture of a bouquet of flowers. Does the smell match the picture? Fantastic. Awesome. Alright, so you passed everything with flying colors. I am also very happy to hear that your symptoms were mild and that they had already subsided. I don't see anything alarming at all, which is great, so you can just basically keep me updated if anything ever changes. We'd be happy to get you in here to check anything at all. So feel free to give me a call. But if not, did you have any other questions or concerns? Okay. Yeah, I'm glad to see you're doing really, really well. So, if that's everything, I will see you for your next exam. Otherwise, you can always contact the office. Fantastic. Really good to see you. And I hope you have a wonderful weekend. Bye-bye. Thank you so much for relaxing with me. If you are not a YouTube Premium member, remember to turn down your volume or turn off your device now to avoid